Hello and welcome back to Inside Chlorpromazine, the show where we explore a decades-old antipsychotic unexpected intersections with modern virology and immunology. Today's episode dives into the immune system, specifically immunomodulation or immunosuppression, chlorpromazine's role in the cytokine conversation. We are joined by Chaitanya, a biochemistry graduate, a microbiology researcher whose work touches on immunological signaling during viral infections. Welcome back.
Thanks, Sowmya. Happy to be here. This topic is especially relevant when we talk about both acute COVID-19 and long COVID.
Before we dive into chlorpromazine's role, can you get can you set the stage? What does the immune response typically look like during a COVID-19 infection?
Sure. In the early phase, your immune system mounts a defense by recognizing viral components and releasing molecules called cytokines. These are like immune text messages that help coordinate the body's defense. But in some individuals, especially in severe COVID-19, the immune response becomes hyperactive, leading to what's known as cytokine storm. This uncontrolled inflammation can damage tissues, especially in the lungs, causing ARDS and multi-organ involvement.
Let's define a key term here. What do we mean by immunomodulation?
It's a good question. Immunomodulation refers to adjusting the immune response, either by increasing it when necessary or calming it down when it's excessive. It's not the same as immunosuppression, which broadly weakens the immune system. A true immunomodulator targets specific pathways to restore balance without entirely shutting things down.
So, where does chlorpromazine fit in?
Chlorpromazine has been shown to have immunomodulatory effects, particularly anti-inflammatory properties. It suppresses the production of pro-inflammatory cytokines like TNF-alpha, IL-IP, and IL-6, which are key players in cytokine storms. At the same time, it can increase the levels of anti-inflammatory cytokines such as IL-10. This rebalancing helps prevent the kind of immune overreaction that worsens outcomes in viral infections like COVID-19.
But wouldn't reducing inflammation suppress the immune system?
Not necessarily. What's fascinating about chlorpromazine is that it's not broadly immunosuppressive. It doesn't seem to impair the body's ability to recognize or respond to pathogens. Instead, it modulates the overreactive pathways while keeping protective immunity intact. This distinction is crucial. We don't want to weaken the immune system, we just prevent it from attacking the host in the process.
Can you explain how chlorpromazine modulates these immune signals?
It likely works through dopamine receptor signaling and its effects on intracellular pathways like NFKB, which is a master regulator of inflammation. Chlorpromazine inhibits NFKB activation, reducing the transcription of inflammatory cytokines. It also appears to interfere with macrophage activation, reducing the release of damaging molecules in the inflammatory cascade.
Let's tie this into long COVID. Could chlorpromazine's immunomodulatory action be relevant there?
Absolutely. Long COVID is often associated with persistent low grade inflammation even after the virus is no longer detectable. This leads to symptoms like fatigue, brain fog, joint pain, and more. By dampening residual inflammation without wiping out immune function, chlorpromazine might help reduce these symptoms. Of course, more studies are needed, but it's a promising hypothesis under investigation.
That sounds ideal. Anti-inflammatory without the side effects of corticosteroids or immune suppression.
That's the idea. Steroids suppresses the immune system globally, which can lead to secondary infections or delayed viral clearance. Chlorpromazine targeted modulation may offer a safer option in certain contexts, particularly for non-severe patients or post-acute syndromes.
What are the gaps in our knowledge here?
The main limitation is lack of large-scale clinical data. Most of our understanding comes from preclinical models or small studies. We don't yet know the best dosing for immunomodulation in viral infections or how individual patient factors affect outcomes. Also, immune responses are complex and personalized. What helps one person might not work for another, especially in something as variable as long COVID.
To sum up, chlorpromazine appears to act as an immunomodulator, helping tone down excessive immune responses in COVID-19 without fully suppressing immunity. This could have major implications for both acute and long COVID management.
Exactly. It's about restoring immune equilibrium, and chlorpromazine is an interesting candidate for doing just that.
Thanks again, Chaitanya, for walking us through this complex but important topic. And thank you, listeners, for joining us. In our next episode, we look at chlorpromazine's interactions with viral replication pathways, a different step in the viral life cycle, but just as critical. Until then, stay curious and stay safe. Thank you.